I'm starting to see teenagers that are coming in with hypertension, and a lot of them due to being overweight and active, strong family history. And so they have a predisposition for hypertension, and we're starting to see it earlier in teenagers. Starting to see it earlier in young adults. Used to be that most of the time we wouldn't see hypertension until people were in their 30s, 40s, usually like that. Now it's not unusual to diagnose and start treating patients in their early 20s. Not as much in the teenage age group, but we are starting to pick it up at that age. And usually at that group, we try lifestyle modifications, get you more active, changing your diet, eating more fruits and vegetables, things like that, staying away from fast foods and things of that sort. I think it's very important to communicate with your doctor if you're having any symptoms. I always tell my patients, I'm one of the few people you don't lie to. You tell me the complete truth, whether you think I'm going to like it or not. Some patients have a tendency to tell you what you want to hear, and I try to encourage my patients to tell me the truth. If you're not taking your blood pressure, when you're not taking your blood pressure, any symptoms you have when you take your blood pressure, I tell them all medications have side effects, even Tylenol, and you may or may not experience them. But the only way I would know is if you're honest and you tell me about it. Some people will stop taking their blood pressure because blood pressure medication because they start having symptoms, and they don't want me to get upset because they didn't take it. Or they will take it. I have patients that will take it at certain times. Well, I don't take it when I get ready to go to church because it makes me go to the bathroom and I have to keep getting up. I don't take it when I'm going out someplace. I only take it if I'm at home. So, you know, simple routines like that I ask patients about. Are you taking it every day? You know, you have to be very specific. Are you taking it every day, or do you take it just on certain days? Some patients take holidays. I have patients that may take their medication religiously for a certain period of time, and then they say, well, I did a medication holiday. I stopped taking it for a while. And so I have to have my patients be honest with me, and then I have to try and explain to them why that's not a good idea, why we have to put you on medication consistently. And if you're having any problems with it, I need to know, because there's so many blood pressure medications out there that we can switch to, we can change to, that may not give you the same problems, and that we need to find the medication that works best for you with the minimal amount of side effects. You should know what medicine you're taking, why you're taking it, and what it's for. As opposed to, well, I take a red pill and then I take a little yellow pill, and my first question is, well, what is it for? Well, I don't know, the doctor gave it to me. And I'm like, no, you should know each and every medicine. You should be able to tell me, that's my blood pressure medicine. You may not know the name of it, but you should know what it's for. And having that two-way communication and encouraging people to be open and to be open about answering questions. You know, on several times during the visit, I keep asking, do you have any questions? If you have any questions, please feel free to ask me. So doing that, I think, allows people to feel free about asking questions, allows them to put out there their vulnerabilities and why they have issues with it. And you overcome a lot of issues of noncompliance because of that.